You know, I saw my first case of chikungunya a few weeks ago in Florida, an 18-year-old, and he was pretty sick. And the thing that impressed me most about it, he had this diffuse red rash. So keep this in mind, you that are practicing. He had really red, hot, painful hands. That was the most impressive symptom that he had from his disease. I didn't know at the time, we sent off blood studies and came back positive for chikungunya. So, I mean, we're starting to see it some, I think, in this country as well. So I'm going to talk a little bit about waterborne diseases, and I think you've all heard about the connections between climate change and health. I'm not going to say anything more about that right now. There are an estimated 9 million outbreaks of endemic waterborne diseases annually in this country, in the United States. Another 9.4 that are foodborne contaminations, and then another 38 million, that's in this country, cases of unidentified diarrheal diseases that cause a number of hospitalizations in the thousands, 70,000 yearly, and 1,600 deaths. So we know that most of that, we've already heard today, is from flooding and storm surge. And if you look at this top graph, every continent in the world has seen a significant increase in flooding over the past 50 years. And of course, this is likely to increase. Globally, over 1 billion people lack access to safe drinking water, 2.5 billion to adequate sanitation, and 5 million, mainly kids, die every year from water-related diseases. I mean, these are really staggering numbers of suffering. As the global warming continues to shrink our water supplies in already very water-stressed regions, as Dr. Adhoot just talked about, populations become increasingly dependent on decreasing sanitary water sources for all their basic needs, and the global burden of water-related diseases will obviously increase. There's a number of things that contribute to that. Certainly, rainfall causing the transport and dissemination of infectious agents. Flooding, the little picture in the top left, actually is in Miami. We're already seeing that when you have high tides and a full moon and perhaps a little wind in our older sewage treatment plants that are combined sewer and wastewater. We have, obviously, sea level rise, enhanced risks of severe flooding that we are seeing now in South Florida. I'm from Tampa. I live in Tampa. Higher temperatures obviously increase the growth and prolong the survival rates of infectious agents. And then, of course, drought, we've just heard, increases the concentration of pathogens, and it impedes people's hygienes to keep clean. And in North America, the most documented waterborne disease outbreaks occur after extreme precipitation events. Bacteria, and I've listed some there, parasites, viruses, various fungi, and harmful algae blooms all contribute to health. This little schematic here just shows, if you look up, the climate change increases heavy downpours, and then you have your sewage overflow that we just talked about from treatment plants, from septic fields, from municipal lines that can't handle this. We just had this happen in St. Petersburg in Florida, where 16 million gallons of untreated, largely untreated and treated sewage spilled into the bay. Obviously, the flooding contributes to fungus and in molds growth in homes. Floodwaters, of course, contain disease-causing bacteria, the viruses and parasites. They contain contamination from agricultural areas, waste, chemicals. All of this gets into the water, contributing to adverse effects in health. Now, I didn't talk much specifically about diarrhea, and I decided not to put a picture up because I think everybody's probably lived it in their lives or had children, and so you've lived that experience. And I don't need to read through all these. You can kind of read through them a little bit yourself. There have been some studies done in India, Peru, and China that found a 1 degree Celsius rise in ambient temperature increased diarrheal disease anywhere from 5.5% to 16%, and found hospital admissions from diarrhea in children increased 8% in a study that was done in Lima, Peru, and that was during an El Nino period. In the United States, by 2100, studies have shown that the Great Lakes climate, a modeling project, will increase overflows of the Great Lakes to 50 to 120%. 40 million people rely on this water, and the Great Lakes hold 40% of the world's supply of fresh drinking water. 9 states drain into the Great Lakes, so we have contamination from other areas as well, including some areas in Canada. And an analysis of 87 waterborne disease outbreaks from 1910 to 2010 showed that heavy rainfall and flooding is associated with Vibrio and Leptospira most common, and those probably aren't things that most of us think about when we're seeing patients with diarrhea. So when you just look at bacterial contamination, certainly toxigenic E. coli is one that we worry about a lot, and it gets in the water from, again, the flooding and the contaminations we just discussed into the food and water, causing bloody diarrhea, vomiting, and it may lead to kidney failure and even death, and we especially see this in something called hemolytic uremic syndrome in children. And most of us are pretty tuned in to thinking about toxigenic E. coli when we see bloody diarrhea and fever in sick kids. Of course, Campylobacter is another common cause of food poisoning from meats and unpastured dairy products and contaminated water, again causing bloody diarrhea. Salmonella is a very common cause of food poisoning in this country and the world, and you all have read about this over the years. Leptospira, on the other hand, is spread through the urine of infected animals and rodents, squirrels, soil, water, mainly during flooding. And again, we see it primarily in kids because they're down there playing in this stuff and putting their hands in their mouths, etc. But we're seeing this increasing. But again, it's one of those things that we need to think about when we're seeing kids with diarrhea in our clinics. There has been an association between precipitation of waterborne disease outbreaks for toxigenic E. coli, and you can see here that when you have rainfall, the thin black line, and then usually 3 or 4 days later you see an uptick in the number of diarrheal cases of toxigenic E. coli. Of course, we have bacteria, the Vibrio species, that are common around the world, strongly influenced by both fresh and marine waters. Vibrio cholera causes an estimated 3 to 5 million cases a year and 100,000 to 120,000 deaths worldwide annually. And again, young children are the most affected by cholera. There's another very virulent Vibrio called Parahemolyticus, and we had a huge outbreak in Maryland in the shellfish industry and also in Alaska. In the oysters in Prince William Sound. So that's the furthest north that bacteria has gotten, and obviously with the warming waters, I think the waters off Prince William that year were like in the mid-50s or higher 50s degrees. So again, a big public health concern and things that we need to think about in caring for patients. Legionella is another one that we hear frequently about in this country. And it's a respiratory illness, actually, that's transmitted solely by water. And there's been some recent studies that perhaps with our warming water, other factors may be associated with an increase in Legionella disease, and primarily amoeba may influence this as they both colonize the waters together. We have a number of parasitic diseases. Certainly Cryptosporidium is common in the United States. It's likely to survive mainly through livestock waste and contaminated water. The oocytes are detected in 65 to 97% of surface waters tested in one study here in the United States, so it's fairly prevalent. Common disinfectants like chlorination are ineffective with Cryptosporidium. There was a huge outbreak in Milwaukee in 1993 from contaminated water. There were 400 cases in the surrounding area of Milwaukee and the city, and 100 deaths. So again, something that we need to think about in public health. And in 1997, there are probably more current numbers, but there were close to over 2,500 cases reported in 45 states in the U.S. So you can see it's pretty much all over as our waters are warming and becoming more contaminated. Giardia lamblia is the second most common parasite in the United States. Again, the cysts are found in raw sewage runoff from animal and human feces. 39% of filtered drinking water in one study found that 17% Giardia in that, and crypto 27%, so fairly significant, and that's filtered water. There was a recent outbreak of cryptospora, another parasitic disease, in 2013, an outbreak in Texas, Nebraska, and Iowa, and that was largely traced back to cilantro that came from Mexico, used in the salad bars, and they were watering the fields with contaminated water. Now, the viral and the fungal and the harmful algae blooms, that's probably an hour talk in its own. But I think, suffice to say that many of the viruses, hepatitis A, norovirus, Norwalk virus, they're heat resistant and they're likely to survive most sewer treatment processes. They're often found in shellfish and contaminated waters. We'll probably be seeing more of these signs, beach closed, warning, toxic bloom. We certainly see this in Florida too often. Our fungal diseases, Cryptococcus and aspergillosis. The thing with aspergillosis that's a little frightening, probably not so much for the United States as some of the developing countries, but it produces an aflatoxin that's very, very carcinogenic to the liver, and especially in people that may have hepatitis B as well, which is fairly prevalent in Africa and Asia. This aflatoxin works synergistically and causes more liver damage. So again, something to kind of think about when we're caring for patients. Naegleria is often one that we hear so much about, heat-loving or brain-eating amoeba. And I'm going to kind of tell you a personal story in just a sec about that, but it's found in warm waters. It's now been found as far north as Minnesota, so the water is warming in Minnesota, as you see here on the East Coast and up into Kansas. Minnesota reported its first case actually in 2010, and that's 550 miles north of where the previous northernmost infection was reported. And all of these occurred after local heat waves. And this is a really frightening, although fairly rare in the scheme of life. I think it's becoming more common and will become more common, but it's almost 100% lethal. This is Philip. Philip is the son of colleagues of mine. The mother is an infectious disease doctor in Tampa Bay. The dad is a hospitalist in Tampa Bay. Philip, like most young kids, was just kind of becoming aware of nature, and he noticed, he knew the world was changing, and he wanted to be part of that change. He wanted to make it better. He was only 10 years old. He was a fifth grader, and he loved swimming in some of the nice warm water lakes around Florida where people have been swimming for years. So he went swimming. 5 nights later, he had a headache, but nothing else really. 24 hours later, he was hallucinating. Of course, his parents, both being physicians, rushed him to the local hospital where they stabilized him and flew him to a tertiary care center in Tampa. And 12 hours he was seizing, and in the next 12 hours he was febrile, high fevers, and in septic shock, and he died, all within a matter of 5 days. His autopsy revealed trophozoites in the brain, heart, spleen, and liver of Naegleria. So his folks have gone on a national campaign. They're working with the AAP and other organizations. The website is here to educate the public about Naegleria. And although it's relatively uncommon, there have been, I think, about 133 cases in the last about 40 years. All but 3 died. And it's a disease that's totally preventable. All you have to do is wear nose plugs. You don't want to get water up your nose, so even in kids that are playing in backyard water slides that would give forced warm water up their nose are at risk to get this infection, this amoeba. Same with neti pots, you've heard about that, the saline washes for the nose to make sure you use boiled water or sterile water. And as physicians and healthcare providers, we need to do a better job, I think, of getting environmental histories and play histories from children. What did they do? Where did they swim? What kind of water? What was the temperature? And especially think amoeba with warm water exposure over 80 degrees. And this particular organization is pushing for some state and perhaps maybe national standards to try and have this reported when various lakes are over 90 degrees. But the simple thing is wearing nose plugs. And I know as a kid, I didn't go swimming anywhere without nose plugs. And they're cheap, and so we should encourage our kids to wear nose plugs in freshwater environments. So there's a lot of things we can do to prevent waterborne diseases. It's a little easier in the United States because, you know, we have we have great sanitation and water. In the third world countries, I think some simple things too, as far as breastfeeding for the first 6 months of life. You know, proper latrines, good hand washing, all these kind of basic things that our moms talked to us about. Develop or enhance the public health surveillance system in your community. See what it is, if they even have one. Foster a response to emergent and dangerous pandemic strains of various pathogenic infections. Work with your local health departments. And educate, health education programs across the country. I think, you know, we just don't think about some of these things. I work in the clinic every day with medical students and residents, and so often, you know, it's just a virus, it's just a virus. Well, I think sometimes we need to think a little deeper about what some of these viruses may be, or could it be something else? You know, when did we have our heavy rainfall last? We had terrible floodings in Florida not too long ago. So I think we need to kind of keep this in the back of our minds when we're teaching and training young doctors and nurses and other healthcare professionals. There were a lot of things that I read. I'm not an expert in this matter, but I'm an expert in getting this little block up on the up on the screen. Anyway, so I read all this stuff, and I just want to share a picture of kind of what I looked like at the beginning of reading and studying some of this stuff. This is what I look like. I mean, there's so much. It's interconnected. It's just really overwhelming. But and it's so, I mean, you just want to keep reading and digging deeper, and another article. But this is why I do it. And you've already heard from others, as a healthcare professional, I think we have a professional obligation. Many of us took an oath to do that. It's called the Hippocratic Oath, to protect our patients from harm when we see it. So we have to educate people so they know this is happening, our health professional colleagues, to educate them. And these are really two important numbers I think you need to keep in the back of your minds every day, 33 and 100. This cute little baby I'm holding, she was actually waving goodbye to nuclear weapons at a rally we had, is what her little hand is doing. She's 33% of the current population, children, but they're 100% of our future. So it just drives me, and I know many of you every day, to do this work that we do. And again, thank you so much for allowing us to come and talk to you this morning.